Hello viewers, welcome to the Bachelor course of Population Studies. Today we will discuss population planning in India. Population planning or family planning refers to the planning of when to have children and the use of birth control. It means planned parenthood. It allows individuals and couples to anticipate and have their desired number of children and to achieve healthy spacing and timing of their birth. Population planning is achieved through use of contraceptive methods and the treatment of involuntary infertility. Other techniques commonly used include sexuality education, prevention and management of sexuality transmitted infections, preconception counseling and infertility management. According to Robert McNamara, a former president of the World Bank, family planning is not designed to destroy families. On the contrary, it is designed to save them. Thus, family planning is not just a method for population control, but in a broad sense, it is concerned with the very quality of human life. Family planning is a social movement which lays emphasis on the overall development of the family, as the basic aim of family planning is to limit the size of the family. Married couples are convinced to adopt birth control methods and to have children by choice and not by chance. They are asked to follow small family norm and the slogan small family, happy family. In India, family planning has been converted into family welfare program which aims at providing material and child health care and contraceptive services. Need of family planning in India. India is the second most populous country in the world after China and is the home of 1/6 of the world population. But it has not more than 2.5% of the global land. It is a resource poor country with high population density of 324 per square kilometer. High growth rate of population puts pressure on scarce resources, resulting in reduction in per capita income, thereby retarding the development process. To understand India's existing population problem, it will suffice to examine the trends in birth and death rates during the past few decades. The table number 1 makes it clear that from 1951 to 2011, there was only some decline in the birth rate. In the same period, the death rate has, however, declined significantly. In 2011, the death rate was just 7 per thousand as against 27.4 during the 1950s. The birth and death rates were almost equal between 1901 and 1921, and this explains why population did not rise in this period. Thereafter, in spite of widespread poverty, some medical facilities improved and epidemics were checked. This brought down the death rate considerably. For the last 50 years, there has been a steady fall in the infant mortality. Smallpox, which took a heavy toll of lives, has been completely eradicated. Other child diseases have also been checked, and thus the infant mortality rate has come down. Over the years, maternal mortality has also declined in spite of lack of adequate hospital facilities and high incidence of poverty. Figure 1 on your screen shows that population of India at the turn of 20th century was only around 238.4 million. This has increased by more than 4 times in a period of 110 years to reach 1210 million in 2011. Interestingly, the population of India grew by 1.5 times in the first half of the 20th century, while in the later half it recorded a phenomenal threefold increase. So, there is a proper need for family planning in India due to some of the reasons which are responsible for the increase in population. Figure 2 on your screen shows the need for family planning in India. Number 1, for rapid and sustained economic development of the economy. High population growth rate tends to retard social and economic development because it places a very heavy burden on education, employment, health, services, food and natural resources, and prevents the raising of the quality of life of Indians. Thus, family planning is essential for an all-round and sustained growth of Indian economy. Number 2, for raising the living standards of the people. Family planning is beneficial not only for an individual but also for the Indian economy as a whole. Family planning leads to a reduction in birth rate of children and therefore the number of dependents in a family. As a result, children will be better looked after, fed and educated. Number 3, for optimum size of the population. With less number of children, the standard of living of the family will improve. Thus, family planning is necessary for better health and long life of mother and child and for overall prosperity and happiness of the family. For improving the quality of population. Family planning is also necessary for rapid economic development of India, as the growth of population is reduced in absolute numbers, the per capita income will rise. This will have effect of improving the employment situation in the country and the unemployment problem will be solved to a considerable extent. For maintaining the health of the mother and the child. On the other hand, small families with less and healthy children have better education and health services through family welfare program. Bring out a healthy labor force. This will in turn raise productivity and income levels in the country. High income will be helpful in maintaining the health of the mother and child. Number 6, for economic growth. Family planning is needed not only to raise the quality of life of the Indian people, but also the level of India's economic development. On the other hand, economic growth improves employment opportunities, raises income and improves the quality of life. Now, the importance of population planning. Family planning program is beneficial not only to individual but also to the whole society. The main advantages of the program are depicted by figure 3. This figure shows the benefits of family planning to various parties. Number 1, benefits to the children. The slow growth of population due to family planning program will be beneficial for the children. A fall in the birth rate will reduce immediately the number of children. This instrument reduces the number of dependents on the working people. Number 2, benefit to the parents. The family planning has favorable effect on the health of the parents. With less number of children, they will be able to raise the standard of living of the family. Thus, family planning is necessary for better health, long, happy and prosperous life of the mother. The family planning will also result in better upkeep and education of the children. Number 3, benefits to the society. The family planning is beneficial both for the individual and the society, since the family planning will result in improving the standard of living of the citizens, the quality of human factor will improve and the society becomes better. Number 4, benefits to the nation. The family planning is necessary for the welfare of the whole nation. The family planning will ultimately result in the economic development of the country. Number 5, helpful in capital formation. The addition to the per capita income can be a source of additional saving and therefore of capital formation. Over a period of time, the reduction in the population growth will favorably affect the supply of labor, in the sense that the increase in the rate of labor supply will be cut down. In such a situation, the phenomena of unemployment will automatically disappear. Number 6, prevention of HIV and AIDS. Family planning lowers the risk of unintended pregnancies among women living with HIV, resulting in a fewer infected babies and orphans. Number 7, empowering people and enhancing education. Family planning helps people make informed choices about their sexual and reproductive health. Family planning represents an opportunity for women for enhanced education and participation in public life, including paid employment in non-family organizations. Additionally, having smaller families allows parents to invest more in each child. Children with fewer siblings tend to stay in schools longer than those with many siblings. Methods of family planning. The use of modern methods of contraception is an important basis for improving the long-term health of adolescent girls. Contraceptives prevents unintended pregnancies, reduce the number of abortions, and lower the incidence of deaths and disability related to complications of pregnancy and childbirth. According to the United Nations Population Fund, if all women with an unmet need for contraceptives were able to use modern methods, an additional 24 million abortions, 14 millions of which would be unsafe, 6 million miscarriages, 70,000 maternal deaths and 5 lakh infant deaths would be prevented. In cases where couples may not want to have children just yet, family planning program helps a lot. Figure 4 on your screen shows the modern methods of family planning, which includes birth control, assisted reproductive technology and family planning programs. Number 1, birth control. Birth control techniques are used to prevent unwanted pregnancy. There are a range of contraceptive methods, each with unique advantages and disadvantages. Any of the widely recognized methods of birth control is much more effective than no method. Behavioral methods that includes such as withdrawal and calendar based methods have little upfront cost and are readily available, but are much less effective in typical use than most other methods. Long acting reversible contraceptive methods such as intrauterine device and implant are highly effective and convenient, requiring little user action. When cost of failure is included, IUDs and vasectomy are much less costly than other methods. Second is assisted reproductive technology. Some families use modern medical advances in family planning. For example, in surrogacy treatment, a woman agrees to become pregnant and deliver a child for another couple or person. There are two types of surrogacy, traditional and gestational. In traditional surrogacy, the surrogate uses her own eggs and carries a child for her intended parents. This procedure is done in a doctor's office through IUI. This type of surrogacy obviously includes a genetic connection between the surrogate and the child. Legally, the surrogate will have to disclaim any interest in the child to complete the transfer to the intended parents. In a gestational surrogacy, the woman who carries the child is often referred to as a gestational carrier. The legal steps to confirm parentage with the intended parents are generally easier than in a traditional because there is no genetic connection between child and carrier. Third one is family planning program. In order to achieve reproductive health, women empowerment is essential. It is also necessary that required changes be made in the social factor that hinders women's overall development and their rights. Reproductive right means women's right to decide whether, when and how to have children, regardless of nationality, class, ethnicity, race, age, religion, disability, sexuality or marital status in the social, economic and political conditions that make such decisions possible. Family welfare program mainly includes number 1, family planning information, counseling and services to women for healthy reproduction. Second is education about safe delivery and post delivery of the mother and the baby and the treatment of women before pregnancy. Third one is health care for infant, immunization against preventable disease. Fourth, prevention and treatment of sexually and reproductive tract infection. Now, obstacles in the way of population planning. Number 1, lack of awareness. Lack of sufficient education regarding the importance of reproductive health and lack of awareness of the harmful effects of neglecting family planning on women's health and indirectly that of children. Number 2, lack of access to medical facilities. In many developing countries, lots of births occur outside a hospital and not many women are assisted by trained health workers either before or after birth. Further, access to state-of-the-art tools is limited. This situation greatly affects the health of mother and child and can result in prenatal and neonatal mortality. Number 3, impacts the health of women. In developing countries, lack of awareness and access to effective methods of contraception and family planning impacts the health of women and indirectly that of children. Key drivers of this problem lie in the roots of society and government initiative. Number 4, no power to women to take decision for family planning. In many males dominating society in the developing world, women are not empowered to take decisions for family planning. Number 5, traditional social attitude. Having many children is considered a benefit as it would mean more hands to help on the field. Number 6. Bias against the girl child. In some countries like India, a girl is considered a liability as dowry has to be paid to get her married. Number 7. Lack of basic infrastructure. In remote and rural areas, hospitals are often geographically far, transportation is inadequate or unavailable, and so many go without any form of medical help or are dependent on very basic facilities, if at all, through small clinics or mobile hospitals on wheels. There is a dependence on herbal medicines and home remedies. Number 8. Funding constraints. As this problem mostly exists in developing countries, there will always be funding constraints. But finance is not the main problem, as lots of private organizations have raised their hand to support such a programs. Even WHO has increased funding manifold. Number 9. Lack of human personnel in the medical field. Developing countries lack human personnel in the medical field. The doctor to patient ratio in developing country is far less as compared to the developed world. Most of the doctors are male and few women visit male doctors due to the society and family pressure. Number 10. Gender discrimination. In many male dominated societies, men consider it below their dignity to use contraceptive tools in their households. Number 11. Religious, ethnic, social issues. Abortion is considered unacceptable among traditional Islamic, Christian and Hindu families. Number 12. Demographic barriers. Elders are often against family planning due to age, old tradition and superstition. Youngsters who want to go in for family planning have to face opposition from their elders. Suggestions for family planning. Number 1. Availability of contraceptives. One of the easiest solution is to make common type of family planning tools like contraceptives easily available and accessible. It can be distributed through a concerted government effort and a robust distribution network. Number 2. More education and information. Another workable solution is improved quality and reach of reproductive health information through government family planning campaigns on TV, radio and posters with support from the local NGOs and local opinion leaders. This would also be the most effective factor, as increased knowledge could start influencing a gradual change in social and cultural attitudes. Number 3. Integrate family planning services with other health services. It includes HIV prevention and care, maternal and child health care, including postpartum care and post-abortion services. Now, major achievements of family planning program in India. The initiatives taken by the government in implementing the family planning program have significant effect on the country as a whole. India was the first country in the world to establish a government family planning program way back in 1952. According to 2011 Family Welfare Program, some major achievements are depicted in the figure 6 on your screen. Awareness of one or more methods of contraception, increase in contraceptives use over the years. Knowledge of female sterilization, which is considered to the most safest and popular method of modern family planning. Increase in the use of condoms. Increased knowledge about contraceptive pills. Low fertility rate among educated women. Low fertility rate among higher income groups. To sum up, it can be stated that the family planning programs are successful to a great extent, but India still has a long way to go. Family planning has always been the main emphasis in the population policies adopted by the Government of India. However, there is a need of more public awareness and public participation. Gender inequality, preference of sons over daughters, low standard of living, poverty, traditional thought process of Indians, age-old cultural norms continue to cause poor family planning practices all across the country. With this, we come to the end of today's lecture. In the next session, we shall discuss another related topic. Thank you very much.